The active ingredient of PLAQUENIL, which is in the antimalarial drugs group, is hydroxychloroquine. PLAQUENIL tablets contain 200 mg hydroxychloroquine sulfate, equivalent to 155 mg base, and are for oral administration. What is PLAQUENIL tablet? What is it used for? PLAQUENIL tablet is used to prevent or treat malaria caused by mosquito bites. This medication is also used to treat certain autoimmune diseases. It belongs to a class of medications known as disease-modifying antirheumatic drugs. It can reduce skin problems in lupus and prevent swelling pain in arthritis. How to use PLAQUENIL tablet? Follow your doctor's instructions throughout your treatment. Take PLAQUENIL with a meal or a glass of milk. To prevent malaria, take this medication by mouth as directed by your doctor, usually once a week on the same day each week. Mark a calendar to help you remember. This drug is usually started 1 to 2 weeks before entering the malarious area. Continue to take it weekly while in the area and for 4 to 8 weeks after leaving the area, or as directed by your doctor. For lupus or rheumatoid arthritis, take this medication by mouth as directed by your doctor, usually once or twice daily. Your doctor may gradually increase your dose. Once you have been taking the medication for a while and your condition has improved, your doctor may instruct you to lower your dose until you find the dose that works best with the fewest side effects. If you are also taking a certain drug for diarrhea or taking antacids, take hydroxychloroquine at least 4 hours before or after these products. These products may bind with hydroxychloroquine, preventing your body from fully absorbing it. Use this medication regularly in order to get the most benefit from it. If you are taking it on a daily schedule, take it at the same time each day. Tell your doctor if your condition lasts or gets worse. It may take several weeks or months to see improvement if you are taking this for lupus or arthritis. Hydroxychloroquine may not prevent malaria in all cases. If you experience fever or other symptoms of illness, get medical help right away. You may need a different medication. Avoid exposure to mosquitoes. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Things to know before using PLAQUENIL. Before taking hydroxychloroquine, tell your doctor or pharmacist if you are allergic to it, or to chloroquine, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Before using this medication, tell your doctor or pharmacist your medical history, especially of a certain enzyme problem, vision eye problems, hearing problems, kidney disease, liver disease, regular alcohol use abuse, skin problems, a certain blood disorder, seizures. If you have diabetes, this product may affect your blood sugar. Check your blood sugar regularly as directed and share the results with your doctor. Tell your doctor right away if you have symptoms of low blood sugar. Your doctor may need to adjust your diabetes medication, exercise program, or diet. This drug may make you dizzy. Alcohol or marijuana can make you more dizzy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana. Alcohol can also increase your risk of liver problems while you are taking this drug. This medication may make you more sensitive to the sun. Limit your time in the sun. Avoid tanning booths and sun lamps. Use sunscreen and wear protective clothing when outdoors. Before having surgery, tell your doctor or dentist about all the products you use. Hydroxychloroquine may cause a condition that affects the heart rhythm. QT prolongation can rarely cause serious fast irregular heartbeat and other symptoms that need medical attention right away. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. This medication passes into breast milk. Consult your doctor before breastfeeding. What are the side effects of PLAQUENIL? Nausea, vomiting, loss of appetite, diarrhea, dizziness, or headache may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was helpful for you, please like the video and subscribe to the channel. I wish you healthy days.